We're joined by Zoom by UK-based Ghanaian pharmacist Kwame Sapon-Asiedu. Thank you so much, sir, for your time. I'm sure you're aware of the latest COVID-19 update, which suggests Ghana is having less cases to deal with. At the same time, though, we're seeing more deaths. Now, 17 deaths have been reported in the last 7 days. How do you contrast the decline in cases with the death rate in the last few days?
Thank you. For a long time, I have discounted dealing with the actual daily case counts reported, and I'll tell you why. If you go back to the Ghana Health Service website, from as far back as the 1st of July, you realize that until yesterday, there was no case reporting that was done within 14 days. The mean, which is the average number of days, was between 31 and 39 days. And it's on the Ghana Health Service website. It's not me saying it. Anyone can go and check it. Which then meant that on average, 58% of all cases reported on a daily basis were reported out of the 14-day case window, which then meant that they never became active cases. They were automatically added on as recoveries or discharge. Therefore, our active cases were bound to decline because the people were not being reported as active when they actually were positive. So that's one thing. What does that mean? What that meant was that those people were walking around in the community thinking, especially when we have about 90% of our cases being mildly symptomatic, thinking that they were okay and infecting other people if they were not observing the protocols, which then meant that community spread was high. And how do I know that? If you look at our positivity test percentage, which is the number of people who test positive from the total number of samples we test on a daily basis, for the past 4 weeks, it's been above 20%, which then means that for every 5 people in Ghana who are tested for COVID, 1 tests positive. The other thing we need to look at is what I normally term the hangover effect of COVID, which is the fact that, yes, 90% of people may be recovering, but we also know that the full effects of COVID, in the sense of whatever chronic diseases you would be saddled with, is not known. Which means that if your mortality is technically low, it doesn't necessarily mean that you are out of the woods, because your health system, especially for a health system like ours, which doesn't have a lot of resources, might be saddled with costs that we are not prepared for. So if I look at the numbers that were reported today, I just don't look at the number in unison, because I've always said that numbers on their own mean nothing. I look at them on the basis of a number of things that are going on and are underlying, and I think that we need to be concerned rather than celebrating ourselves.
Doc, are you surprised that health officials in the KJB district are also complaining about lack of funds to fight the pandemic?
No, I'm not. I am not, because if you look at the WHO protocols around testing and being in control or ahead of the virus, it's clear that if your positivity cumulated, which is since the pandemic arrived in your country, is above 5%, you are not testing wide enough. If over a consistent period of time, which is normally 4 weeks, it is between 3 and 12%, your testing is okay but could have gotten better. The minute it's above 12%, you are definitely not in control of the pandemic. We have for 7.5 weeks been above 12%. In fact, for the first 5 weeks, we've been above 20%. So why am I not surprised? I'm not surprised with the KJB complaint because, like I said earlier, the mean time within which results are being reported is over 30 days, and it's on the Ghana Health Service website. So if they are telling me that it takes them a long time from getting the samples even to a testing center, and I know that from the time of the sample being taken to the time of the patient getting their results is above 30 days, why should I be surprised? The person is speaking actually what is known. It is just that people haven't paid attention.
Interesting, but what should be the way forward? Certainly, something is not being done right.
It's not about something not being done right. I've always maintained, right from the start of this fight, that we need to be candid with ourselves, because when it comes to testing, it involves money. If you look at a PCR test, it takes between $65 and $100 for a single test. At the moment, Ghana has done close to 420,000 tests, which means that you are talking about, if you go by $100, you are talking about $42 million in testing alone at the upper limit, and slightly lower, roughly above 31,000, 32,000 if you look at the $65. And therefore, we need to be honest and candid with ourselves and ask ourselves the question, can this country fund this level of testing for an indeterminate period? And for me, the answer is no. And that is why our testing levels are dropping, and that is why our new cases are dropping. And that is why also funds going to the hinterlands, like the KJB director was saying, is sparse. And therefore, the time taken, the lag time between samples being collected and patients getting their results is also elongated. But if we continue down this route, then obviously we would always have this virus riddling our economy. And for me, that is the biggest worry, because if that goes on, what it means is if and when the world opens up, we would not be ready to open up, even if we open up unilaterally, because no one would want to come to the country knowing that the potential for contracting the disease is high.
It is indeed worrying. I'm grateful for your time. Kwame Sapong Asiedu is a UK-based Ghanaian pharmacist, and he's been speaking about a decline in numbers and increase in death rates in COVID-19 cases.